Right, and welcome back. Breakfast Central, Olisa and Felicity today on the program. Don't forget, you can catch us on Twitter and Instagram at News Central TV. Log on to the website, www.newscentral.africa.
Yes, indeed. I want to take a look, and a more intense look at the vaccination campaign across Africa. We know for a fact that on 30th of January, 2021, Covax notified African countries of its planned rollout of the vaccine to African countries by February. About 320,000 doses of the Pfizer-BioNTech vaccine have been allocated to 4 African countries, Cabo Verde, Rwanda, South Africa and Tunisia, and the rollout continues as Nigeria received its first rollout as at the 2nd of March. We're now joined by UNAIDS Executive Director, currently in Nigeria, Winnie Byanyima. Thank you very much for joining us.
Hello, Winnie.
Thank you for having me. Hi.
Hi.
Hi, Winnie. Welcome to the program. Winnie, as this rollout, began, how do you think, these countries who have gotten the vaccines are doing with their vaccination drive so far, so good, from your observation?
Well, what is happening around the world today has been called by the South African people a vaccine apartheid. We're seeing many people, a handful of countries rich countries have booked out most of the vaccines, are vaccinating their people last month at a rate of one person every few seconds, literally, while in more than 130 countries, not a single dose has been received, vaccinated into someone's arm. And that's because the vaccine producers are hoarding their patents, their technology, and not allowing others to produce so that we all recover fast. It's a global problem, but some leaders are allowing a handful of pharmaceutical companies to monopolize the technology and therefore be able to hike the price and keep it there as people die. This is not right. We are calling for the technology, the know-how to be shared with other vaccine producers through a WHO pool, and then have production going up and being scaled up across the world so we all recover from this crisis.
Okay, could this be the reason why we have this scenario where the Interpol has caught people in China and I think in South Africa with fake vaccine doses? What can What can African countries do? Because they were warned. It's not like it's just happening now.
Oh, African countries are not sitting back and waiting. First, there is an initiative called Covax where some rich countries have put some money and enabled some vaccines to be bought and shared in developing countries. This is welcome, but it is not enough. That is why you have seen 4 million doses arriving here in Nigeria and in other countries. 26 countries in 6 regions have been receiving now the vaccines from the Covax initiative. This might be able to help developing countries to vaccinate maybe up to about 20% of the people they want to vaccinate, but it isn't enough. We need in every country to vaccinate up to herd immunity. Africa has estimated that they want to vaccinate 60% of the population. And the African Union is helping to book as much vaccines, as many doses as possible from around the world. Because now we have at least 5 or so licensed or approved producers of the vaccine across the world, not across, mostly in the rich countries, and more are coming up from developing countries. There are 2 vaccines in China. There's another one in Russia. In fact, in Morocco, they have been able to vaccinate.
Right, Winnie. Well, you just
Yes.
you just talked about, the vaccines, China, which is the Sinopharm, the one in Russia, Sputnik V, and we know the popular ones from the West, AstraZeneca, and the likes. But I really need to ask you this, especially with your organizations and your unit, as executive director there. Should African countries go for bilateral agreements apart from Covax? Because with Covax is what we've seen for Nigeria, Uganda, and other countries that have gotten the vaccination so far. But should we, move beyond the Covax facility and get personal with these countries to get more vaccines in? Because just like you said, we need to get more vaccinations in Africa.
African countries cannot sit and wait. Like I said, the Covax initiative is welcome, but it's not enough.
Okay.
African countries have done the right thing, pulled together as Africa and led by the Africa Center for Disease Control are going out and looking for more quantities. They have booked some quantities with one of the Chinese companies. They are in touch with also the European and American producers, and that's the right thing to do. But the most important thing is to continue pressurizing for the patent rights to be waived at the TRIPS Council. And indeed, South Africa, together with India, are leading a proposal right now to waive the patent rules so that everyone can access the technology and make the vaccines. And secondly, also to continue seeking to book more and to call for sharing of that technology, whether by voluntary licensing, but preferably through the World Health Organization CETA pool.
All right, Winnie, I want to ask you, while we're working to get the vaccine and, getting innovation to make sure, getting innovative rather, to get our own vaccines, what about acceptance and deployment? There is still a lot of skepticism among Africans as to, should I take the vaccine, should I not? How can African countries work harder to ensure wider acceptance of the vaccines that are available?
Yes, there is some vaccine hesitancy, and that is understandable because of the past. Africa has not been treated well. Some bad medicines have been tested on African people, but this is not the time for hesitancy. We know, because we are really sadly in the back of the queue, that the vaccine works. We have the evidence where it has been applied, it is working. So we need to encourage our people to accept it, and when we get it, to get on, to come forward and be vaccinated. And that's why you see leaders coming forward when it arrives and having it in their arms in the full public. That's the right thing to do. We know that it works, and we know it is the only way we have out of what started as a health crisis and has now become an economic and social crisis. We need to get out of it. And we must call out and campaign and explain to our people that it works and it is safe.
Well, Winnie, I need to ask you this one, because this goes even beyond Africa and looking at it, outside the continent on the global scene. Yes, we know that in terms of this pandemic, Africa had lesser deaths than people dying from the disease than in Europe, and Western countries and America. Do you think that's part of the reasons why there's been this vaccine nationalism, particularly with Western countries who've been accused of hoarding these, vaccines and buying 5 times over the stockpiling quantity to vaccinate their nations while leaving other African countries behind? Do you think that's why Africa didn't have so much debt, so why should we bother?
I didn't quite hear your question, but...
Go on, Winnie. Hello, Winnie?
Winnie doesn't seem to have gotten the question.
I'm there, yes.
Okay, Winnie.
Yes, hi.
Okay, do you think because we had less deaths in Africa, that's why these countries are hoarding them vaccines and not letting, African countries have access, and we have so much vaccination hoarding in European and Western countries?
No, in the beginning, in the first phase of this crisis, it was very important to do the tests, because at that time, the virus was coming from outside and hadn't penetrated community. So if you could trace and test and isolate, you could block it from spreading very fast.
All right.
But after a couple of months, it entered community. Now there's so many people out there with the virus. It's important that they come forward and get tested, because when the symptoms, when you've just had it, the possibility to recover when you get treated, put on oxygen and all that is there. But when you leave it till late and you have, say, comorbidities, it can be too late and death can happen. So it is important to keep telling people to come forward and test if they suspect that they have been in contact with someone with the virus.
All right.
Most important message is to tell people to prevent by social distancing, by masking, by limiting their movements and contact with people.
Okay. Well, thank you so much, Winnie, for joining us on the program. We really appreciate it. I'm very, very grateful and honored to have you on the program, Breakfast Central.
Thank you for having me, and thank you for the good job you do to inform the public about the virus. Thank you so much.
Thank you.
Have a good day.
Right. Wow.
I think
So much.
she did say it's not a time for us to have any sort of hesitation when it comes to accepting to get vaccinated. So people should really listen to people who are in the forefront and know that the efficacy of this vaccine has been proven by presidents and leaders.
Health experts, basically, people on the field. So we just had the Executive Director, United Nations Aid Agency, yes, Winnie Byanyima, yes, South African, currently right now in Nigeria, giving our thoughts on the vaccination rollout program across the African continent. A quick break will do it for us, but when we come back, there's still more to talk about right here on the show.